Good day, everybody. I'm Dr. Samwa. I'm a nutritionist. There are other people, they call it as a dietitian. I'm also a medical doctor who has been treating so many patients with diabetes, which is called sugar disease. Why is it called sugar disease? And why do we need sugar in the body? Sugar in the body is needed because we can't, let's say, breathe, we can't walk, we can't do anything that needs energy. The energy comes from the sugar. And where does the sugar come from? It's all the food that we eat has sugar, except the water that does not have sugar. So how does this sugar produce energy? It is like Eskom that produce electricity. Without coal or without diesel, electricity will not be produced. So it's the same way. In the body, the energy we need for the heart to beat, for us to move up and down wherever we want, or sports, we need the energy, and the energy is coming from the sugar. Now, how do we get it? When we eat any food, whether it's meat or whether it's vegetables, fruits, whatever, at the end, sugar is going to be produced in the body. So this is where we eat the food. When we eat, the food goes down to the stomach and goes to the intestines. From the intestines, it is absorbed into the blood. The sugar is absorbed into the blood, but the energy is not produced in the blood. The energy is produced in a special organ that is called mitochondria. It's like, as I said, Eskom. The sugar should go to this like a factory called mitochondria. Then there's a process of producing energy. But the problem that we have is the sugar cannot go to this factory because at the entrance of the factory, there are gates, there are locks, the way you see. You need a special key to open those gates. And where does the key come from? The key comes from in an organ called pancreas. Is where the keys are produced. And that key is called insulin. Without the insulin, the sugar cannot go. The sugar can't go to the factory or to the mitochondria to produce the energy. So we need that. So every time when we eat, the moment the sugar goes to the blood, the pancreas produces those keys to help to open to the factory so that the energy should be produced. But some of the food, some of the sugar, it does not only go to the blood and stay there and make the energy. The body knows it was made in a way that we need to save a certain amount of sugar somewhere, and that is in the liver. The sugar is saved in the liver, so that should the sugar be very low, the liver will release that sugar, go to the factory again to produce energy. But as I said, without the key that is produced by the pancreas, the sugar can't go to the factory, and no energy will be produced. So, but the problem because diabetes has two types of diabetes that are common. One is type 1. Type 1, it means the keys are not being produced. That is type 1. The body does not completely produce the key. Then what happens? How do we survive without the key? Then that's why there are factories that produce different medications. So those who don't produce the key, we are going to get a key from outside as insulin, as in injection. So we get the insulin from the companies, pharmaceutical companies. We inject ourselves to produce that key straight. It goes and open the gates to produce the energy. And that is for life. You need that. But the type 2, that is common. The pancreas produces the energy, produces the keys, but the keys are bent or in a wrong shape, or the keys are not enough. So if the keys are not enough, and the keys are not working properly to open, we need a help, an assistance for the keys to be enough and open the gates here. So what do we use? That's why we need some drugs that we take, and it goes to the blood, and they make the keys. That drug, it helps to make the key to be opening properly, because it was not opening properly in type 2. So that key will come here, open it, and then the sugar will go into the factory like Eskom, using the coal to produce energy. We are now, the mitochondria is going to produce that energy because the keys are now working properly. That is how it works.